Dear class of 2028, I am deeply honored in the presence of all who have gathered here today to bear witness as you cross this important threshold into the noble profession of medicine. There are certain inflection points in life, moments that mark a permanent shift, moments that forever alter our course and divide life into before and after. They're sometimes hard to spot when they're actually happening, but trust me, this is one such moment. Years from now, or even decades from now, you'll look back and see that today marked the beginning of what I hope will be a long, productive, and meaningful career in the field of medicine. For some of you, considering the time, the work, and the longing that preceded your arrival here today, this moment may seem surreal. But remember, you've earned your place in the class of 2028. No one handed it to you. Study, dedication, and ability got you here. And study, dedication, and ability will propel you along the most life-changing pedagogical adventure you could ever imagine. But before I describe that journey, let me say that the quality of education you will receive at the University of Manitoba is second to none. The dean did not ask me to say this. It has been my good fortune to lecture and teach in places whose names are steeped in history, tradition, and drip with status, places like Harvard, Yale, Cornell, Stanford, the University of Oxford, King's College, Cambridge, and the list covers hundreds of others across the entire globe. I can tell you, having seen it firsthand, the quality of students and the quality of instructors here at home take a backseat to none of them, which means receiving your MD at the Max Rady College of Medicine will set you up for whatever you want to do in any capacity, here at home or anywhere on earth. Right, Dean Nickerson? Yes. Good. As for the journey itself, because of its sheer complexity, you will be guided along what at times will feel like multiple parallel pathways. Cardiology, nephrology, neurology, rheumatology, respirology, endocrinology, immunology, hepatology, gastroenterology, ophthalmology, otolaryngology, and various other ologies that are sure to keep you busy and fully engaged over the next 4 years. Well, this siloing of the human body is necessary to help you wrap your mind around its various complexities. There is a danger, and that is losing sight of the whole person. In my own writings, I describe this as the problem of patienthood eclipsing personhood. I recall a mid-career nurse telling me that she felt burnt out. After so many years, she said, patients have begun to feel like kidneys on legs. She knew this wasn't good for her, nor her patients or their families, because it meant she no longer saw them as whole persons. Our research shows that when this happens, it can diminish trust, empathy, compassion, and respect. Patients who don't feel seen are less likely to trust us or to tell us what they really need, increasing the chances of discordance in goals of care. Our studies show when healthcare providers experience patients based solely on their illness, without consideration for who these patients are as persons, they become less satisfied with their job, more robotic in their work, and more vulnerable to burnout. Another interesting thing we found was that how patients perceive themselves to be seen is the strongest predictor of sense of dignity. In other words, Patients are looking for a reflection in the eye of the healthcare provider that will affirm their sense of themselves. If all they see in this metaphorical reflection is a problem checklist or a differential diagnosis, they end up feeling that the essence of who they are as a person has fallen off our radar. This idea of personhood being under assault or threatened or starting to disintegrate has long been considered central to the experience of human suffering. So, we must ask patients what they would want known about them as persons to provide them the best care possible. Take it from me, the responses you will get to that question will permanently change the way you see your patients. A former head of a department of medicine told me, while being treated for cancer, that he felt like a PIP, P-I-P, previously important person. When I asked an Aboriginal woman with advanced cancer on our ward what I should know about her as a person, she told me she was a residential school survivor, that her family had moved 82 times so no one would know them, and that she didn't trust healthcare professionals who wore white coats. Without knowing something so central about who people are and the nature of their suffering, a commitment to person-centered care is little more than lip service. What all of this means is the way we are with patients and our attitude towards them will profoundly shape every single clinical encounter and their illness experience. This means that you need to be mindful of your outlook, and more specifically, what shapes it. We all intuitively use ourselves as a gauge for what patients want or need, the so-called golden rule, doing unto others as we'd want done unto ourselves. This is an important moral adage appearing in various religious traditions across millennia. But we need to be aware that the lens through which we see our patients has been shaped in ways we may not be entirely aware of. About 5 years before she died, my sister Ellen was back in hospital, this time in intensive care. Ellen was born with cerebral palsy and had many of the physical challenges that go along with that condition, including poor respiratory capacity because of various complex anatomical distortions. She couldn't blow out her birthday candles, which by the end of her life numbered 55, if her life depended on it. But this admission to ICU was unlike any other because she was now on the brink of respiratory collapse, and the question of intubation was on the table. I remember her intensivist pacing the unit as he contemplated whether she would need a breathing tube inserted. At one point, he came over to me and asked the only question he was going to ask about personhood. Does she read magazines? It struck me as an odd question, and it took me a minute or so to sink in. His unspoken question was, is this the kind of person we should be intubating? He could see her bent spine, he could see her spastic limbs, he could see her dropping blood gases. What he couldn't see was Ellen and the rich, full, complex life she lived. Realizing her life hung in the balance, I took a deep breath and said, yes, she can read magazines, but only when she's in between novels. Amongst Ellen's problems that day, besides her difficulties breathing, was the lens of the healthcare provider, through which he could only see her suffering. I can assure you, when she was on the dance floor, the only people who suffered were those whose toes she crushed unapologetically under the massive weight of her electric wheelchair. The take-home lesson is the golden rule must accommodate what I have coined the platinum rule, which would have us doing unto others as they would want done unto themselves. This is a reminder that we must face our own biases and have the humility to know that we can't presume to understand how someone sees and experiences their life and priorities. Now, I mentioned earlier that you might be finding this ceremony rather surreal. I forgot to say that those feelings apply to me as well. My medical education began 46 years ago in 1978. Yes, Trudeau was still Prime Minister. And yes, my daughter warned me that the younger members of the audience might not get that particular humor. Well, I hear myself saying these words aloud. It seems inconceivable that nearly half a century has slipped by. Trust me, while the days may seem to move slowly, and you find yourself thinking that some clinical rotations will never end, the years go by in a flash. After my first 10 years in practice, I felt I could claim professional credibility. 20 years in, I'd become what you might describe as a seasoned clinician. After 3 decades, people started to use words like senior scientist, distinguished professor, and pioneer. While I know those were always spoken in kindness, it did imply I was moving ever so gently but steadily towards my best before date. And now, closing in on 5 decades, has me thinking that destiny may see me become a fading faculty fossil. But so far, those who sign my contract have seen fit to keep me around. So let me close with some advice flavored with my fossil-like perspective. 1, the past is irretrievable, and tomorrow is uncertain and unknowable. The only thing you can absolutely know is the here and now. So be present in your life. Take in today, and each subsequent today you are fortunate enough to be given. Take in the privilege of learning and evolving, of love and relationships and experiences, and take time to express gratitude to those who hold you up and make you covet more tomorrows. 2, resist comparing yourselves to others. Self-doubt may find you thinking others are more capable than you, are smarter than you, are more deserving than you. But consider this. Since the beginning of time, 117 billion people have been born on Earth. And never has there been, nor will there ever again be, one entirely like you. Each of you belong here, and each of you bring talent, experiences, perspectives, creative and intellectual energies that are entirely unique. That is something you should honor and nurture. Allow yourself to dream and pursue whatever goals you are striving for. Make peace with the person who looks back at you in the mirror each day. If you can do that, you'll be able to work out your connections with everyone else. 3, strive to be more than human body mechanics. Aspire to be healers. Years ago, I wrote an article called "The Secret is Out. Patients are people with feelings that matter." You are about to spend years looking at your books, and will soon be spending years looking at medical charts. But I implore you to look up from those books and charts and see your patients. Patients will not care what you know until they know that you care. 4, making connections with patients based on caring, what I call the human side of medicine, will infuse your work with meaning and purpose and richness, which will nurture and sustain you over the course of your entire career. 5, Resist skepticism and despair. There is no shortage of pain and conflict in the world. Life can be hard. Working in medicine will expose you to situations that will sometimes make you feel there is no justice, nor rhyme or reason for the suffering people must endure. As healers, you aren't expected to cure what can't be cured or fix what can't be fixed, but you are expected to show up for your patients, to accompany them. Please know that in exercising kindness and compassion in every clinical encounter with every person whose path you cross, you are playing your small part in bending the arc of the universe towards hope, healing, and peace. Class of 2028, welcome to the profession of medicine, a profession William Osler, one of the great pioneers in our field, described as the science of uncertainty and the art of probabilities. Well, no one can say with certainty where medicine will take you. The possibilities are limitless. Enjoy this magnificent, transformative journey and use all you learn along the way to make the world a better place. Thank you.